Fertility has definitely a lot of misconceptions. So, can you share a bit about what some of those misconceptions are and how can a person advocate for themselves once they're in that doctor's office and maybe getting the same
For
like
sure.
blank stare or like
Yeah. Yeah. I mean, I think the biggest myths that I hear now to this day is that it's not predictable. Like you have no idea that it's gonna be an issue for you until it's an issue. Which honestly, it's not true. There's lots of signs and symptoms beforehand that tell you that you're probably are going to struggle with getting pregnant. And the myths of like, you can't really predict what your pregnancy journey is going to be like, what your postpartum, because it all comes down to what's the base. Like if you are the vessel that's growing this baby, then and that requires an insane amount of energy, an insane amount of nutrients, good hormone function, right? Good blood sugar regulation, thyroid function, immune system function. Now, if those things are not working well, what are the chances that you might struggle? And I really say there's no guarantee when it comes to pregnancy and your fertility journey, but there's probability. So the probability of you struggling to get pregnant is much higher if you have an irregular cycle, if you have a cycle that's really heavy or really light, because those are all signs of hormone dysfunction. If you have acne, if you have thyroid issues, if you have weight loss resistance. Why? Because those are signs of either toxic overload, you have poor hormone function, again, with whether it's insulin, blood sugar, or cortisol when it comes to weight loss resistance. It maybe it's low nutrient status that's causing. So it's kind of this rabbit hole that you can go down in terms of what's causing what, but your body's always talking to you. So the myth of you can't predict it, it's just going to show up when it shows up is really not true. I think that if we're in tune with our body, we can tell that something is off here. And if something is off, that probability of, being able to have a healthy baby starts to go down. The other myth, big one, is that males are not as big of a component as females, but males provide 50% of the DNA. And now we're seeing a huge decrease in the sperm quality. So 40 to 60% of the times it's male factor infertility. And that's a huge number, right? Whether it's a pregnancy loss or not being able to get pregnant. I can't tell you how many men sperm I look at. And it's like, even if they're supposed to be really healthy, young, 29, it's like, this is low count for somebody who's 29. So what's going on? And digging a little bit deeper. So that's kind of the myth, the big myths, I would say, in terms of advocating for yourself. It's, I'm going to bring it back to my story. If you're sitting in front of your doctor and they're telling you that everything is fine and that's normal, what I say to that is you're already sitting in front of someone who's not willing to listen to your problems. So you just described a doctor that you have who's really great at listening. And she said, you have taught me so much. That's amazing. That's what your doctor should do. So you are, I don't want to say like you're the leader. You get to decide. If you don't like your doctor, you can find another one. And sometimes it feels like, oh, but I can't because it's going to be across town or they're not taking it. If it's important to you, you're going to make it happen. That's all it is. And so if you're sitting in front of someone and you're telling your problems, it's like, think about getting into a relationship. So if you're on the first date and that person that's sitting in front of you is right away, like not listening to you, not like doesn't seem interested, would you go on the second date with them? It's like unlikely. The first date is when you're supposed to show your best cards, and so it's the same. Like I find it's a relationship with your doctor. And so if your doctor isn't very receptive and it's a very intimate, vulnerable experience that you're trying to, you're sharing a very vulnerable piece of your life, then it's go to another doctor. And it's like, yeah, but I've been to 5, go to 10. Like, how important is this for you? Because it wasn't my first naturopath that healed me. It wasn't my second or my third. It was like my 5th. And that's a naturopath, like we're trained to listen. And it's not that the other they just didn't understand me the way that this naturopath did. He got me, he understood me. I felt heard, I felt understood by him. And so that's why I healed, because it was like, I had a very trusting relationship. So if you don't have a trusting relationship, you just have to keep searching. And whether it's online, whether it's, in person, because that's then it's easy for you to advocate for yourself because your doctor is listening to you.
Yes. Yes. And you can ask for tests specifically. And if they kind of bulk and talk about cost or whatever, like what I learned works really well. I've learned this with specialists is prove to me that it's not this. And then I'm like, fine, we'll order the test. And then you're like, and then you get the results back. And for myself, I knew I had something wrong with one of my ovaries. I knew I had PCOS, but I really knew something was wrong. And intuition, I don't know. It just, there was
exactly.
pain.
Your intuition is so powerful.
There was something. And so my doctor sent me to one of the, top gynecologists in the city to do a look. And he talked about, oh, it's your weight and, the usual stuff, like come back to me after you lose a few pounds. I'm like, no, you prove to me right now, what test are we going to do? So they did an MRI, and I did have a bleeding ovary, and I was in a lot of pain. And when they finally did the surgery, it had bled so much, my whole abdomen was fused to my bowels. It was a very intense surgery. It saved my life. But it took
just
me saying
that you had to ask for that. Yeah.
Just to say it, prove to me that it's not. And then I'll leave your office and I'm fine. And actually that doctor apologized. And that's really sad, right? It shouldn't have to be that way. But I do imagine they do get quite a few keyboard warriors, but they do need to listen. It's just time, right? Our healthcare system is so overstrained, which doesn't help either, right? They're overstrained and underfunded, and the whole system is a big
it's
problem.
Breaking. I mean, we could see it through the pandemic, right?
Yes.
And so I try to empower my patients even more and say, pay for the tests. Like I run the tests.
Yes.
And it's out of pocket. And when people say, well, is it covered by insurance? It's like, listen, when does your car insurance kick in? Is it to change the oil or to switch up the air filter, or it's when you've been in a major crash, right? Even sometimes if you get into a fender bender, you're like, I don't want to activate my insurance because that means my insurance is going to go up. And so we have to stop thinking about this like insurance as a way. You might have to fork out some money for yourself to pay to understand what's going on. And that's really kind of and I understand that still, I mean, in the US, they're kind of used to paying for it. Where in Canada, we're used to having these things covered, but then you're looking at time. And so how much is that time worth for you?
Yes.
And, I hate when docs say lose some weight and then come. It's just like, do you know that it's really hard for me to actually lose weight because of the inflammation and the hormones and all of the stuff? Like you could be eating like a bird and not be able to lose weight, which actually is creating a lot more stress and blah, blah, blah. But, the weight is just a symptom.
Yeah.
Like it's not the root cause. So if
not.
someone is, even if they're overeating, then I'm looking at, well, why are they overeating? Are they stressed? Do they have dopamine issues? What's causing them not to be able to control themselves?
Yes.
Right. Or to make choices that they know, like most people know, sitting and eating a bag of chips every night before bed isn't good. People know that. So why do we keep doing it? Well, because there's usually some sort of an imbalance, right? There's whether it's neurotransmitters, whether it's nutrients, whether it's just stress and cortisol and feeling unfulfilled, whatever it is, like dig deeper, but you can't when you're seeing thousands of patients. And so to me, it's like it's worth your investment to work with a practitioner who's going to care.
Yes. Yes.
And like, oh my God, but you are the vessel that's living here. Like I was at a point where I couldn't leave the house unless I knew where the bathrooms were. And it was like, this person is telling me that's normal. So what's my other option? Okay, well, I'll invest into a practitioner and I'll continue to invest because I know that like I'm the greatest ROI.
Yeah.
I have the greatest return of investment on myself. I can work and make more money. I can do whatever. And, versus asking for the right thing, but the wrong people,
Mhm.
you're always just going to feel helpless. And it's take the power back, do what you need to do to make it happen, because you are a really important investment.